We are all anxious about every sneeze, every cough, every door handle as we confront an outbreak of flu coast to coast in this country. And it's not just the flu, another virus is on the move. I want to show you pictures that say everything. Patients wearing masks. And also doctors wearing masks. ABC's Linsey Davis spent the day at the hospital with the doctors on the front lines.
All day long, Dr. Ron Walls is rushing down the hall, a squirt of hand sanitizer, and he's off to battle more flu.
But it's going to take you probably 2 or 3 weeks to feel really good again.
Dr. Walls is wearing a face mask because he simply can't afford to be sick. Not now with Brigham Hospital, like many in Boston, overrun with flu cases. This patient has been battling the flu for 10 days now.
So you've been coughing a lot, right? What are you bringing up with the cough?
While we were there, the cases mounted, so much so the hospital sounded an all hands on deck code Amber alert.
It's basically a disaster notification that we use when we have a large number of things to deal with.
Thanks.
At Holy Name Hospital in Teaneck, New Jersey, Dr. Randy Tartikoff is battling against the tide.
We are all a little overwhelmed, not only the practitioners, but the caregivers in general.
Numbers are so great, Dr. Tartikoff isn't even administering flu tests. He's handing out treatment.
A lot of what we do is simple supportive care, making them feel better.
The most vulnerable patients, children and the elderly. But this flu can also have deadly consequences for healthy adults. Strong immune systems can sometimes overreact and destroy healthy tissues along with the flu itself. And this year, there's a double threat. Not only is flu rampant, so is a nasty stomach bug called the norovirus, now widespread throughout the country. It's also very contagious and another serious concern for hospitals. A perfect storm of sickness, which is why today 45,000 Bostonians got an automated call from the city.
Residents who have not already been vaccinated against influenza this year are urged to get vaccinated by calling.
Dr. Walls, for one, is hoping people listen. He knows better than anyone flu season hasn't hit its peak yet. So far, this hospital has treated 280 confirmed flu cases. In all of last year, they just had 63. But this is another hospital where doctors say they're beyond the point of testing every patient. Their focus right now is simply treating them. Diane?
Overwhelmed. Okay, thank you, Linsey Davis. I want to bring in ABC's chief medical editor, a veteran virus hunter himself, Dr. Richard Besser. So, Rich, should everybody be going to the ER when they feel sick?
Yeah, I mean, absolutely not. If you were healthy before you got the flu and you're handling it well, you don't need to rush to the ER or your doctor's office. They're going to keep you waiting a long time, and while you're waiting there, you could get sick with another virus. So give them a call, and they could handle it that way.
And who should go? What kind of symptoms?
Yeah, you need to watch for the signs. If you have any difficulty breathing, any shortness of breath, you may have chest pain, that could mean pneumonia. Sudden dizziness or confusion could mean that you're getting dehydrated. And if you're getting better and then you start to get worse, that could mean you have a bacterial infection on top and you need to be seen right away.
You didn't mention fever.
No, it depends what goes with the fever. Fever by itself, don't worry about, but if it has any of those other things, get seen right away.
All right, thank you, Richard Besser.